Hello and welcome to a special episode of the Caring Support Podcast. We are excited to be coming to you today with a special mini series called the Caring Support Care Kit. We've created this series to talk about how we and healthcare workers can take care of ourselves on a day-to-day basis. We're very lucky to have the amazing Karisa Haverkamp, registered psychotherapist, founder, and clinical director of Blossoms Counselling in Brantford, Ontario. Welcome, Karisa. We're glad to have you here with us today.
Thank you.
So before we jump into the big question of the day, can you tell our listeners just a little bit about yourself?
Sure. So I, like you said, I'm a registered psychotherapist. I'm certified perinatal mental health specialist. So I work primarily with young moms, working moms. I do witness and see a lot of burnout and caregiver stress through the roles that they carry. I also have experience working with complex trauma on the Six Nations of the Grand River Reserve. And I've been working 10 years in the field. So that's pretty much my counseling career.
That's awesome. I actually didn't know that you had been doing it for that long. I thought you'd only been for a few years, but that's really cool. And so Blossoms is your business, correct? Right?
Correct. Yeah.
Yeah, that's awesome. All right, so we are going to talk about one topic here today. So our care kit question for the day is, what is burnout? Why are so many healthcare professionals suffering with it these days? And what can they do to prevent or treat it if they are already feeling it?
Okay. So that's a loaded question. Burnout is like it's a severe stress condition. So essentially it's caused when you experience chronic stress over a long period of time. And it leads to severe physical and mental and emotional exhaustion. So, and it's a serious condition and needs to be treated. It doesn't go away on its own. Symptoms of burnout, how you kind of recognize it for yourself, what to notice would be frequent illnesses, irritability or impatience on a daily basis, trouble focusing, feeling overwhelmed, things like social withdrawal, increased errors and mistakes at work. There's also symptoms that are similar to anxiety, so increased heart rate, chest tightness. There can also be difficulty with sleeping, low energy, and like sort of escape fantasies. So like thoughts about travel or leaving the situation.
What can people do to prevent it, or what should they do to treat it?
Right. So prevention can be difficult because it can be hard to recognize, especially if you're experiencing it for the first time. Oftentimes, your support system will be the first people to recognize that something's off. There are some behavioral changes, or you seem to be more tired or less involved or engaged with life. But it's important to kind of like tune into your body, notice if you're holding any tension or stress. Things to prevent it would be regular exercise, eating healthy, sleeping. Also asking for help and tapping into your social support network would be the primary, like the pillars to self-care in terms of prevention for burnout.
Yeah, all things that can sometimes be pretty hard to do. Like you're tired at the end of the day. It's like the last thing you're thinking of is eating right, exercising, or even going out with your friends. So definitely something that can be hard to do, but it's still really important.
For sure. Yeah. And the busier you are, the harder it is to get those things in, right?
Exactly.
So it can be a problem that kind of compounds on itself.
Yeah, exactly. Especially for, I mean, any worker really, like anyone that's working that's also got, a family at home or maybe is caretaking for family members or friends or someone else that's sick at home where they don't necessarily feel like they get to just go home and let go of everything, right? So I think from what we hear from different healthcare workers that have been on the podcast, that's the difficult part is that when they come home, but they don't really get that, that relaxation at the end of the day, or they've worked so hard that, they're just going to bed, but they wake up and they do it again the next day, and it's a lot. So it becomes heavy.
It does. It's carrying the weight of everyone else in your life, right? And everybody else's needs. And that's exhausting.
Yes. And I think that's where it's probably the most important. And I'm sure you would agree that, you have to take care of yourself before you can take care of other people. Because if you're not doing well, then it's really tough to take care of others.
Right. You can't pour from an empty cup.
Exactly. Exactly.
I mean, if your car was running out of gas, right, or it was out of gas, you'd have to fill it up. You can't run an empty car either. So we just tend to fill ourselves up last, taking care of everybody else first, and it doesn't continuously work that way, right? Because you run empty.
Yes. Yeah, exactly. Well, thank you very much for going over burnout with us. Thank you so much for being here today. And we really appreciate your knowledge and sharing that knowledge with us. And the work that you're doing within your community is amazing. And we're looking forward to more episodes in the future.
Thank you very much.